Absolutely. And I think that years of stress and strain on the body, I think exposure to hazardous chemicals, I think, the strain, post-traumatic stress disorder, there's a lot of guys who have TBI, who've had multiple, concussions and things like that, or have been exposed to, substantial amounts of, near contact with explosives, whether it's breaching or mortar, RPG fire, things like that. That those folks do have pituitary issues, or maybe not necessarily diagnosable, but certainly either clinically low or suboptimal testosterone, and the whole cascade of ailments come from that. The testosterone seems to be able to really help to resolve.
Absolutely. And it's not exactly just the number. And sometimes I have military, well, every patient will come in, well, what level are you trying to get me at? It's more an important function of getting the person to feeling better, which is what testosterone does. If that number happens to be 600, that's that person's sweet spot. If it's 900, that's their sweet spot. So we're not necessarily trying to titrate to a certain number. We want to get that person feeling much better. Again, in the case of my military patients, the results I see are actually amazing with testosterone replacement.
And the goal when administering testosterone is to produce a specific outcome, not a specific number. And that's why you're not so concerned about the specific number they start with, and you're not so concerned about the specific number they get to. The goal is to actually alleviate symptoms and resolve their issues.
Absolutely. There are certain parameters in medicine where the number is more important than a person's symptoms. As an example, blood pressure. But hypothetically, if you came to me as an internal medicine patient, said, "Doc, I feel great, couldn't feel any better, but I find your blood pressure is 240 over 140, which is dangerously high," I'm going ballistic. I'm saying, "Andy, I get you to the emergency room for a shot to lower the blood pressure. Got to do this test of the heart, this test of the kidney immediately. It's a medical emergency." But he's, "Doc, I feel great." Well, high blood pressure can cause a lot of silent damage to you.